Hello everyone. We will see what are the causes of poor R wave progression in ECG. The thing is, this particular segment is often not interpreted properly. First, we will know what is poor R wave progression. Here, just remember, if the R wave height is less than or equal to 3 mm in lead V3, we can consider it as poor R wave progression. So normally when QRS complex or R wave in particular travel from V1 to V6, we should be able to see the change. Like initially it will be small R wave in V1 and it will slowly become larger and larger. So this is called as normal R wave progression. And suppose in this particular lead, suppose the height of R wave is less than 3 mm, we will consider it as poor R wave progression. Overall, the change should be seen at V3 or V4. That is, when we compare this R with the S wave, R should become larger than S wave either in V3 or V4. If it is not happening, then we consider it as poor R wave progression. Here is an easy comparison. Normal R wave progression, it is progressing normally. Here it is small, becoming larger, and the change is happening at V3 or V4. But when we compare on the other side, here, first of all, R wave is still smaller than S wave even in V3, V4. And according to the definition, here we can easily make out the R wave height is not more than 3 mm. It's almost 1 mm only. So this is also suggestive of poor R wave progression according to the definition. So once the meaning of R wave progression is clear, we will know what are the causes. For the causes of poor R wave progression, we can just imagine a person is trying to reach the top by climbing this staircase. In the sense, R wave is becoming larger and larger in the precordial leads. This is the comparison. So, when will be the difficulty for that person to reach the top? Those are the causes of poor R wave progression. So, the first reason will be if the person is too heavy. For example, if there is left ventricular hypertrophy or right ventricular hypertrophy. Then, suppose there is a loss of steps in between, like the bridge is lost somewhere in between. That we can compare with anteroseptal wall MI. So because of this infarction, there is a loss of the bridge. That's why it is difficult to climb. Similarly, we can enlist dilated cardiomyopathy. So here the muscle wall is thinned so much that the conduction will be very much delayed, leading to poor R wave progression. And one more reason for poor R wave progression is, suppose if the steps are built in such a way that the lower steps are too lower and the top ones are abnormally at too much height. In the sense, if we place ECG leads inaccurately, so inaccurate placement of leads can also lead to poor R wave progression. In the sense, usually we will keep V1, V2 at 4th intercostal space, right? This is normal. But by mistake, if these leads are kept at 2nd intercostal space, that is too high, then the R wave progression will be slow. So these are some conditions which we can easily remember by comparing with the staircase. Hope you will never forget the causes and the meaning of poor R wave progression. Thank you so much.